This is service delivery for transition, age, youth, and adults, empowerment versus care. My name is Lauren Fry, and I'm on the side of empowerment.
My name is Goethe Laurent. I am as well on the side of empowerment.
My name is Shelby Smith, and I will be arguing for the side of care.
And my name is Samantha Molesky, and I'll be also arguing on the side of care. The way that we structured our debate is we created subtopics that are all relevant to our topic of empowerment versus care. And they will be comorbid disorders, social skills, self-sufficiency, quality of life. We'll then talk about the ethics portion. Each side will conclude. We will then discuss some relevant questions that relate to our topic. And then we'll post all of our references for you guys. So we will now start with comorbid disorders. So autism spectrum disorders is often accompanied by comorbid disorders that may require treatments of their own. Some of the most common comorbid disorders, as shown in this graph, are ADHD, anxiety, and depression. And there are other less common comorbid disorders that also occur, and they are bipolar disorder, obsessive compulsive disorder, and oppositional defiant disorder. An individual with ASD may also suffer from comorbid physical impairments that affect their ability to be independent and may also factor into the transition decisions that will be most beneficial for them. If a person with autism spectrum disorder suffers from physical impairments that prohibit them from dressing themselves or walking without assistance, a more care-oriented approach would be the best choice for that client. They would have access to supports that would help them with hygiene efforts and just general life skills that they're incapable of performing independently. And this would then allow them to lead a happy and healthy lifestyle.
So according to an article by Van Stansel and Bogels in 2015, nearly 40% of those with ASD suffer from clinical levels of anxiety, which is a pretty big number. Those with autism spectrum disorders that suffer from high-level anxiety exhibit symptoms that, according to this article, are associated with more behavioral problems and a higher level of life interference. Those with high levels of anxiety might find it difficult to handle the pressure that comes from making decisions regarding their transition to adulthood. This is why it's so important that there are people and programs in place that will help guide these individuals towards the decisions that are best for them. If they succumb to the pressure that exists due to their anxiety, they might rush to make a decision or make an uninformed decision that could negatively impact their future, which is why it's so important to have these programs in place to really ensure the care aspects of transitioning.
As these individuals get older and they begin a new chapter in their lives, anxiety can play a big part of their life. In typical adults, they may experience the same feelings for anxiety when coming into new situations like these individuals. Adults with ASD that have a diagnosis of anxiety, all of these symptoms can be increased. They will be presented with new people, new environments, which can create unpredictability. Results from the study, Sheck, Zamra, Teddy, and First, 2015, showed that not only the youth's concern for transition to adulthood caused anxiety, but fears with finding a job. Another individual claimed that they feared getting a job because they were afraid they would get fired, and they couldn't work in the evenings because their medication would wear off. All of these things created anxiety in these individuals, which made it difficult for them.
Okay. Having any type of disability is already a tough thing to deal with. Therefore, a comorbid condition renders life even more challenging. One of the tenets of quality of life is the possession of social skills. For students with ASD, a psychiatric comorbidity will greatly affect social skills. According to Angels, the greatest impediment for individuals with comorbid ASD and anxiety is the lack of theory of mind. What is theory of mind? According to the authors, theory of mind connotes recognizing that we all have our thoughts, and that sometimes they may be different from those of other individuals. And Charles devoted a full session of the training to teach children with comorbid conditions how to acquire awareness of their own emotions. The expected result of this training was to help them to be able to make personal decisions, which is something all behavior analysis, tries to do.
Moving on to social skills. It is known that individuals with ASD struggle with social skills. A way to empower individuals with ASD is using peer models. According to Sheck, Zamra, and Teddy and First in 2015, challenges that individuals with ASD face is their need for mentors and models to model appropriate behavior, time management skills, roommate etiquette, and social connectedness. Along with this, many parents are overwhelmed with teaching their children social skills and how effective social skills mentor would be in the workplace, as it could provide a model prompt for individuals with ASD.
Effective implementation of treatment to individuals diagnosed with comorbid conditions represent a challenge in regard to social skills once again, especially those who suffer with anxiety or any neurological disorder. I'm going back to the study by Henschel. According to Henschel, Polacek, and McMahon, psychiatric comorbidity affects social skills gains in the ASD population. The ideal training for individuals with comorbid conditions should focus on cognitive training and the hope of lessening the anxiety. There has been many studies that have been able to support the effectiveness of cognitive therapy to reduce the level of anxiety in young individuals with ASD. However, Angelis also suggests that the emphasis on the attainment of social skills lack in all these studies.
So, on the other hand, we're going to pull up a graph that's going to show relating back to the comorbid disorders that we already discussed. So in discussing those comorbid disorders, we saw a 32 to 52% comorbidity rates of the presence of social skills, of the presence of anxiety in individuals with autism spectrum disorders. It's apparent when discussing the presence of social skills, especially in terms of holding a job successfully, that the traits of anxiety can potentially come into play. It's important when discussing the components of care to consider whether or not an individual has the social skills to hold a job independently or even have conversations with other people that they'll come into contact with, such as a doctor, a pharmacist, a store employee, anything like that. An individual with ASD that is lower functioning won't possess these social skills that are required to complete everyday tasks.
A study by Wilkins and Matson, 2008, determined that those with autism spectrum disorders displayed the greatest deficits in positive social behaviors and negative nonverbal social behaviors compared to individuals with ID who did not possess an autism diagnosis. Knowing this, it would be best to lead families who have an individual with ASD towards a program where the family member would be provided an aide to accompany them on errands or any sort of social outing. And this will help assure the family that the individual will be safe in the social outing or while running errands, but will also help the individual navigate those social situations that would otherwise be very overwhelming to them. Transitioning to self-sufficiency, keeping all of what we said in mind, depending on the types of programs that are available to individuals with ASD, they may not come out of their school program at the transition age equipped with the social skills that allow them to maintain a job or be independent in the community. This will again lead the family to look for options that assure them that their family member will be properly cared for, and they can then arrange assistance for hygiene or just completing tasks, or it can range to then someone helping them keep track of their finances or just assuring that they get to work or social functions on time when they have to navigate public transportation and situations like that.
The individual might also have the option of being placed in a program that teaches them these skills while not leaving them completely on their own. However, it would be hard for an individual with ASD who's not self sufficient to be able to find a job because it's possible that employers might not feel completely comfortable leaving the individual without constant supervision. This is just another reason that exploring care options is so important. It's also important that the care strategies employed are adapted to the needs of the individual in order to ensure that they are able to succeed to the best of their ability. Self sufficient in an ideal world is something we would like everyone to be able to achieve, but in some cases, it's just not as possible or as easy. So, providing care for these transitioning age individuals is so important for that reason.
In order for individuals to be empowered to be self-sufficient, they need the necessary tools to make them successful. McDowell and Revel in 2010 discussed how individuals with ASD are empowered through different agencies offered by states to achieve employment goals. They discussed vocational rehabilitation agencies that specially provide services for assessing, guidance, training, and job placement services. Another was community rehabilitation programs, whom are non-for-profit that assist individuals with disabilities in obtaining and keeping competitive employment. Boards also help find and provide services, opportunities, and employment for individuals with developmental disabilities. Another source was one-stop career centers that were available for anyone who need help locating employment. These tools can help an individual with ASD feel empowered by learning and preparing for their job.
Okay, all behavior analysts want clients, all individuals with disability, to be self-sufficient. Is that a realistic goal? Can all individuals with disabilities, especially those with comorbid disability, can achieve self-sufficiency? The sad reality is not all of them can attain such goal. Care should be taken in helping those who have the potential who can achieve this goal. Clegg, Murphy, Almack in 2017 referred to these failures as anomaly and hope that we will be able to recognize it one day. For valid reasons or not, they blame this failure on neoliberal stance of the idea of treating everyone the same. This view is based on the fear of being accused of exclusion, thereby lessening equality of outcome.
So here we have some graphs. These are unemployment rates from 1986, 1994, and 2000. And as you can see, this is all adults with disabilities, which would be considered ages 18 to 64. And as you can tell, the employment rates really have not changed a whole lot in about a 15-year time span, which is pretty interesting. And then the next graph shows that 79% of adults with autism are unemployed. And this also shows the employment rate of other individuals with disabilities. And how important employment is for our individuals is it really helps them have a quality of life, which we'll be talking about next.